Hello, NAAOP members and friends. This is Peter Thomas in Washington, D.C. Today I'm talking about Veterans Affairs benefits and access to orthotic and prosthetic care. Congress is poised to go on their congressional recess any moment, any day now. But before they did that, they held a hearing. The third hearing that the House Veterans Affairs Committee has held on prosthetic procurement changes that the VA is proposing in the last 3-month period. So this is the third hearing where the Health Subcommittee or the Oversight and Investigation Subcommittee of the House Veterans Affairs Committee delved into the issue of prosthetic procurement for veterans. That's an unprecedented amount of time that any subcommittee spends on a particular issue. And so it's clear that this issue has gotten the attention of the committee. On a bipartisan basis, both the chairman and the ranking member and members of the committee on both sides of the aisle are very concerned and dedicated to finding solutions to this issue. The issue involves the Veterans Administration changing how it purchases prosthetic care under the VA for veterans. Many people across the country are feeling the effects of that. We at NAAOP have received numbers of calls and emails from our own members, let alone others, veterans and prosthetist orthotists, who have been essentially told that they need to go in-house to receive veteran care from now on, and that they either don't have access to the same prosthetic componentry, or they no longer have access to the prosthetic practitioner that they've been going to, in some instances, for years, and in some instances just down the road from their homes. These changes are causing some concerns that are making their way up to Congress. This third hearing that they held sought answers from the VA. In fact, answers from pretty high up in the VA. The Undersecretary for Health, Robert Petzel, who is a doctor, testified at a recent subcommittee hearing. And ultimately he was the only witness that was called. There were no other witnesses. The hearing lasted about an hour and 15 minutes long, and it focused solely on prosthetic procurement and what these changes are going to mean to the end user, the veteran, and of course the providers who serve veterans across the country. You may not know this, but there's 600 separate contracts with private prosthetists that the VA has. And veterans are served in a variety of different places around the country through prosthetic care delivered by private practitioners. The hearing focused on a number of provisions that will be implemented soon by the VA, but some key points came out of the hearing. Number one, the transition has been delayed until the end of September, and the VA is open to delaying it further if they're not ready to roll this out without hiccups or problems. Number two, it's clear that they believe the process of procurement changes will not impact what the VA purchases, but instead will simply impact how the VA purchases prosthetic care and the items that are inherent in prosthetic prescription. Number three, they said that the veteran would see no change whatsoever from the current prosthetic procurement process that they use currently. And this is designed to be completely transparent to the veteran. And so they made great efforts to say that whatever the physician prescribes, whatever the rehab or amputee clinic team prescribes at the VA will be provided to the veteran, and the warranted officers within the prosthetic procurement process will be obligated to provide whatever the physician decides is necessary and appropriate for the patient. Finally, they stressed that veterans do in fact have a choice to access private practitioners. And they also stressed that the veterans have access to the technology of their need and desire. They've said very explicitly that veterans who would like to use new componentry, new technologies, and they even cited some by name, are permitted to get access to those technologies. So they established in the course of this hearing some very key principles that the NAAOP has been seeking to establish through the VA Injured and Amputee Veterans Bill of Rights, which is currently pending legislation, H.R. 805. We think that this bolsters the chances of actual legislation being passed. It's clear that the VA agrees with many of the provisions in that Bill of Rights. And yet the legislative process is very difficult to forecast and difficult to negotiate. We will be meeting again, along with all of the members of the O&P Alliance and AOPA and others, to make sure that the VA and the O&P groups continue to dialogue on these issues and try to improve care for veterans. So thanks so much. Have a wonderful August, and we'll talk with you soon.